that I've recently discovered that I love that says, loneliness is a type of tax for a certain uniqueness of mind. Have you ever heard that?
No.
Yeah. I forgot the gentleman's name that the quote came from, and there's probably a longer form of that quote, but what you're just saying, it's lonely as the CEO. I've discovered, especially as you like get higher up in the world, maybe you're more successful, whatever, you famous people, right?
Yeah.
You presume they're surrounded by friends all the time. It's actually really lonely.
It's really lonely. Yeah, I can see it.
Yeah. So does that ring true in kind of the position?
For sure. And also as a CEO, you usually get all the bad news first.
Okay.
Right? Like when he's going well, nobody's going to tell you, hey, it went well or it went as planned. They reach out to you and say, hey, it messed up. Like we messed up or this didn't work. And it just like, it means that you get a lot of bad news throughout the day. And if you're just by yourself and you don't have anybody to vent to, because the only person I can vent with is my co-CEO.
Yeah.
So that's going to like help.
Yeah, that's what I discovered too. Like obviously some situations there's a board of directors maybe that you can pick up and call or a confidant, right? But that is, you're in your position, the buck sort of stops with you literally, right? Of making decisions. And so.
Yeah, and the fact that we have each other and we do a lot of venting with each other.
Yeah, that's good. I mean, that's really good. Yeah. I've sat with some of our previous co-founders. Every once in a while, I'll be a confidant for somebody else.
Yeah,
there are situations where you need to be able to literally just vent about a situation and have somebody not really necessarily judge you.
Yeah,
it's like no, they're just going to listen, and then maybe they'll give you a little bit of direction or advice. But everybody needs an outlet.
That's right.
Communication.
Everybody needs it, and especially in a position where it's very stressful. There's a lot of things happening, and as I said, like the good news will not travel as fast as the bad news.
Okay.
And in a day, and also I think in a startup, you celebrate the good for like a second and you move on to concentrate on what you haven't accomplished yet. And you really dwell on when things are not working.
Oh, and you think you linger longer on the things that aren't
100%.
working?
Because when let's say we just closed one of our biggest customers 2 weeks ago. We celebrated for like maybe a second. And then we moved on because we want to get our next bigger customer.
Right.
And we want to create the next feature or the next way to make the product better. We always concentrate on what we haven't accomplished yet.
Yeah.
And we rarely stop and just celebrate the things that we have accomplished.
See, I think that's the blessing and the curse. And I've had, fortunately, had access to a number of business founders. The blessing and the curse of being an entrepreneur is you never quite feel like you've accomplished anything, even though everybody else might look at it and say, oh, what are you talking about?
Oh, look at us, right? Like we just celebrated our 2 years. We're 45 employees. We have dozens of customers. We are working with companies that are huge and would have never looked at a company that's 2-year-old like us, and they are. And we are not celebrating that enough. We're really focused on, okay, what's next? And
so you think you actually should, though, take a little bit more time to celebrate? I think that's a good insight.
So my co-founder and I we do couples therapy.
Okay.
We do it like once in a while. We'll talk to a therapist, not because we're thinking about getting a divorce, but just because we need a place where we can talk about feelings.
Sure.
And one thing that she said is that when was the last time that you actually, stopped the company and got everybody together and say, okay, what are we thankful for? And I haven't. And then I did it that day. We kind of like, at least the people in the US, we kind of got them together. And I asked each one of them, hey, take a minute, think about what you're thankful for, and then share it. And it was an amazing session.
I bet.
And we just realized there's so much we need to be thankful for. But we just don't do it because we concentrate on what we haven't accomplished yet.
Right. That's what you got to take stock. And Nathaniel was really was just part of the 100th episode that I was sharing with you earlier that we shot. I had some really good friends that are in the business join me on that episode as well. But I felt that milestone was worthy of taking a moment and actually celebrating. We even had some Weller's bourbon that was donated to us that we brought out towards the end of the episode. But it was, for me, I don't do enough of that myself because it's always like, well, what's the next episode? I got to hit the mark. I got to do this. I got to do that. But if you don't celebrate, you could also run the risk of running yourself into the ground.
You're burned out.
Yeah, you're burned out.
If I look at if the startup life was a chart, right? Like when you're in high and when you're in lows. Unfortunately, I'm in much more lows. Obviously, the chart, like the trend is up, which is great. But the lows are peaks, and the highs are peaks, and the lows are like plateaus because it goes down, and then you stay in that. You kind of like dwell on it until like the next high. You celebrate for a second, and then you go on. Yeah, and it shouldn't, but it is. I think it's human nature.
Yeah, I would agree. Are you happy with something you were changing? Okay, cool. Yeah. Yeah, and some of that may be usable. I just always like to kind of keep an open dialogue so we're
Yeah.
not sitting here cold. But go ahead. We'll kick off the podcast. So
Sure.
we got the green light, Nathaniel? Okay, cool. So I'm sitting here with Guy Benjamin, who is the co-CEO and co-founder of Healthee. How you doing, Guy?
I'm great. I'm happy to be here.
Well, I'm happy to have you, man, and thank you so much for traveling in from New York. I know you had some other engagements that brought you down here as well, but I'm never not grateful for people willing to come and travel to be on the show. So thank you again, sir.
Yeah, and Texas is one of my favorite places to visit. So
Yeah,
I'm happy to be here.
I'm not having you come into an area where it's frigid temperatures or it's not 120 degrees yet.
No,
So if you're here in July, you might be singing a different tune. But Healthee, real quick, Healthee is Healthee. Correct?
Exactly, which is basically when you think about it, is health, and EE means employees, so healthy employees.
I didn't know that. I'm gonna have to talk to Nina about. She didn't tell me that later, but we had a fortunate opportunity, or I did, I should say, to get connected with your company about a year ago. I know we have some mutual connections as well, and Omar ultimately is the one that coordinated this. So shout out to him. So real quick, before we dive into your product, could you at least categorize what it is, what the subject of today's show is, and then we'll go back and hear a little bit of your personal story as well.
So we developed an AI-based platform that is basically a one-stop shop for all of your health and wellness needs. So think about today, employees or users, they need to pick a plan during open enrollment. They need to know what they're covered for, find providers, book appointment, know the deductibles, know how much things are going to cost. So we kind of like packed everything in one platform that is an AI-based platform. And on top of all of that, we kind of built the first ever personal health assistant called Zoe.
Zoe, yeah.
And she can answer any question about your health benefits. So forget about the days where you call the call center to figure out what you're covered for, or went to 5 different platforms to figure out a doctor or book an appointment. You go to Zoe, and Zoe has answers to all of your questions. For example, you can go to Zoe and say, hey, my daughter needs a speech therapist. She'll tell you if you're covered for it, where can you get it done, how much will each location cost you based on your deductibles.
Okay.
She'll book you an appointment, and she'll even help you kind of understand if you get billed correctly.
Well, so Zoe is almost like Alexa, if you will, but for healthcare, right?
Exactly.
Or Siri, depending on which one you like to use. But I saw it about a year ago, and I do want to talk about the evolution of the product, because I know what I described back to you, having seen it then versus what is now, is night and day difference. It's almost a different solution and a better solution, obviously. Right. But to give people some context of the solution itself, I want to hear more of your backstory, how it came to be, what drew you to develop this company, et cetera. So why don't you give us a little bit of your biography, if you don't mind?
Sure, yeah. So I'm originally from Israel. I grew up there. I'm the youngest of 4 brothers, younger by a lot. So I have a brother who's 17 years older than me.
Okay.
And then twin brothers who are 13 years older than me. And then my parents really wanted a girl, and
they didn't get
it. I got in. I got out. And so I grew up in Israel. Joined the Air Force when I was about 18. I was a fighter pilot. Flew F-16s for about 13 years in the Israeli Air Force. Last role was a squadron deputy commander. Finished that in 2012, and then came here to the U.S. So 11 years ago. Went to Yale for my MBA, and while I was at Yale, I wasn't really sure what to do after. I was thinking about going back to the military. Somebody said you should check out consulting. I asked, what's consulting? I Googled consulting. McKinsey was the first thing that showed up on Google, and I applied, and I ended up.
Well, I'm sure. Well, with your obviously your service history, and then going to Yale, getting an MBA from there, you were tailor made to be a consultant. What was your experience like as a consultant? Did you enjoy the work?
I loved it. It was amazing. I love the fact that you can switch project every few months. I love the fact that you get like a problem and you just go try to solve it as hard as you can with any resources that you need. I love the people that I work with. Some of them are still my best friends. It was a great experience, but it was also something that really helped me kind of prep for. I always knew that I wanted to start my own company, and I knew I had like 4 rules that I wanted to when I do start this company. Right? I wanted it to be something that does good for society. I wanted it to be something that I am passionate about. I wanted it to be like kind of like an infinite market.
Okay.
And then last thing is something that I kind of like thought about after, but I wanted to work with people I really like. Okay. And not just go do it by myself.
Well, I would say that's probably one of the most important of those 4 is actually working with people that you enjoy working with as well.
Yeah. So that's kind of like while I was working at McKinsey, I always had that in mind. I'm like, okay, I need to find something where I'm passionate about, that's good, infinite market with people I like.
Gotcha. So I know you're on your way, obviously, to already accomplishing that, and I want to hear more about Healthee. Can I ask you real quick, and I won't make you detail too much of your service because I realize that can be a gray area sometimes, but what led you, I know military service is compulsory in Israel, but what led you to ultimately wanting to be a fighter pilot and fly jets? Like, did you know that what you wanted to do going in?
So I didn't know that going in, but it was always something on my mind. I have kind of a unique story where I actually didn't start in the Air Force. I started in the infantry. I started in this like small commando unit in the infantry. Did that for about 3.5 years, and we did it in a place where it was right next to an Air Force base.
Okay.
So I kept seeing these Apache helicopters and F-16s just flying all over, and really got me thinking that I want to be there.
Yeah.
So I applied kind of late to the Air Force Academy. And it's interesting because every year about 20,000 people apply. 400 will start the academy, and then 40 will graduate.
Whoa, okay.
So it was really against the odds.
Because it's such a difficult program to
It's difficult,
achieve.
but they're also looking for specific skills and traits, right?
Okay.
Like it doesn't mean that if you're not going through the entire academy that you're not as good as the one who did. It's just like they're looking for specific traits and skills. And I happen to have that. So I graduated in 2005. And stayed for another 7 years after that. But what interesting was that I graduated in 05, and then in 06 there was a war in Israel. So as a very young pilot, I got a chance to kind of participate in that, which was a very, very honestly like a life-changing event.
I only doubt. I have friends that are in the service in the States, and I mean, you can't compare battle and warfare to anything else in life. And so you kind of know how to navigate a conversation about that, knowing that I could never empathize or relate, unfortunately, to that experience. But you spent a considerable amount of time though in it. But was there a moment in time where you felt compelled to do something different, go in private sector, obviously go study? Yeah. What was that like to transition out?
So it was interesting because when I decided to go to school, I still in my mind had this sense that I'm going back to the military. But then I showed up on Yale campus, and it was literally kind of feeling like the entire world is opening up to me. Because as a pilot, your world is fun, it's amazing, it's intense, but it's very narrow.
Okay.
You're really focused on just being the best pilot that you can be. You're focused on being a really good leader, and you're focusing on protecting your country. And when I came to Yale to the campus and started meeting people from all over the world, I was like, okay, I did that for 12 years. Maybe it's time to kind of go do something else.
Okay.
And that's what got me thinking about it. I also realized when I was at Yale, and I just started, from being a squadron deputy commander, it's a role where you know everything that's going on in the squadron. Nothing happens without you knowing about it.
Okay.
And I thought that when I go to school, I thought the squadron was going to collapse because I'm not there. And the phone didn't ring. Like I moved and nobody needed me. And it just got me thinking that also everybody's replaceable.
Well, I'm no joke. I literally had this conversation with somebody yesterday. And my version of that story was leaving the soccer program at my alma mater, Drury University, in college. And even if you are a good player in a team, I was a captain of that team, you feel like you're an integral part of the team during that tenure. I had a realization about 2 to 3 years after, as we were going back for the alumni game, but the program goes on without you. Nobody even bats an eye. Nobody thinks about you anymore. And so I think it's fun to know that you have a moment in time where you participate in something, but the systems that exist or the programs that you participate in will ultimately move on from you. And you got a chance to be a part of it, but you also have to accept that it will no longer need you at some point as well.
And again, my time in the Air Force, I was there for over 10 years. It was amazing. In the Air Force, you don't have friends, you have brothers. And I still think of them today, to this day, right? It's been 10 years since I left.
Yeah, absolutely.
But it was something that probably shaped me the most, right? Because also my entrepreneurial skill set, the way I try to accomplish things, the way I deal with problems, it's all from the Air Force. Because in the Air Force, what's interesting is for every mission that you have, a mission could be an hour, where you just go or cross the border, come back, and do something there. You probably train for days, if not weeks, for that specific moment, right? And you get ready and you kind of learn and you say, okay, if that scenario happens, that's what I'm going to do. If that scenario happens, that's what I'm going to do. And if something completely different happens, then I'm just going to get a mix of those scenarios that I prepared for and do something. And it prepares you for real life, honestly.
Yeah, absolutely. The podcast I was on was called the Dad Pod Dad Bod podcast. Shout out to David Basileros. It's about youth sports, and he's real big on making sure parents and coaches are they understand what the role that youth sports play in a kid's life, and that the overwhelming majority won't go on to be pro.
Right.
But what tools, what traits, what characteristics, what life lessons can be drawn from that experience to be taken on to your real life, and that's exactly what you were just describing as well. But was there a moment, as you went to Yale, then you started working at McKinsey, right?
Yeah.
How many years did you work there?
7.
7. Okay. Was there a moment of an interaction with the healthcare system that ultimately led to Healthee? Because usually there's a story there. So what's your story? Yeah.
So when I was at McKinsey, there was very early on, I kind of realized that I have no clue about my health benefits. And every time I have a question, I would be sent to HR, and HR would send me to a call center. And that call center either gave me good service, maybe sometimes not, sometimes answered my questions, sometimes not. And it just got me thinking that there has to be a better way. And I also realized that I'm spending more money than I should be. I realized that there's benefits I just don't know about. For example, I wear glasses. I didn't even know I was covered for glasses for the first 3 years.
Okay.
I have twins.
So first 3 years,
I just paid for glasses.
I
have twin girls. And when we had them, it was an at-risk pregnancy.
Okay.
We had to do a lot with health insurance. And it just got me thinking that this is silly. Like, I remember when I was a child, I would go with my dad to the bank to see how much money that he has in the account, right? Like, we would go check. Today, nobody does that, right? You do it on your phone. We still call centers to figure out what we're covered for.
Right.
This is like the most important thing we have, our health. And that moment was like when I thought, okay, there has to be a better way. There has to be a way to kind of inject technology into this space. And by the way, at first I thought it was a me problem because I was an immigrant, I was new. But then I started asking friends. They're all in the exact same situation where they have no clue. So that was kind of like when I first.
Well, that's what your story echoes a number of founder stories that I've had on the podcast that do different things than what you do, but there was always this interfacing or interaction with the healthcare system, this recognition that this thing is very complex and inefficient and broken, and there's too many moving parts and I don't understand it. But there was an epiphany for them that, I'm going to go fix it. So was there an interaction that happened that you go, now I'm actually going to dedicate my life to this instead? Yeah.
It's a good question. I think it was a process because when one of my co-founders is a really good friend of mine and a doctor, he came to visit me from Israel to New York, and we started talking about it. And we thought, okay, we can't just not do anything about it. It's not our nature. We have to go try and do something about it. So we started talking to investors. We started talking to other people in the industry, and we realized there's something there. First of all, every investor we spoke with was like, okay, I have the exact same issue. Nobody ever told us, no, I know exactly what I'm covered for. I don't need help understanding my healthcare. And it just got us thinking, okay, there's something here, and we want to go pursue it. And I think when we started meeting with really do meetings with investors, and we have amazing investors, shout out to Dovey Francis from Group 11, who's our lead investor. They believed in us. And when we saw that support, we were like, okay, we're going to go do this. And to go do this, you need to be fully committed. It's not something you can sit on the sidelines.
Yeah, you have to go all in. I was going to ask you, though, I know it's probably a subject of a full podcast in of itself, but could you juxtapose the healthcare system in Israel versus the United States, and maybe what you might liked about that existing system versus here, and vice versa?
Yeah, I'm not sure there's something vice versa.
Okay.
But in Israel, it's a social healthcare system. You don't have to worry about how much a doctor is going to cost. You just go. There's no in or out of network, or very, very, there's like 2 networks maybe, or 3, and that's it.
Okay.
You don't have to worry about if you're covered for something. You literally just go to a doctor. And when I'm in Israel, I tell people that you will never understand the sense or the feeling where you get a referral for an MRI and you're not sure if you're going to do it because it may make you go bankrupt. Right. Or you have to go to the ER and you're afraid because you're going to get a $5,000 bill. That doesn't exist in Israel. So it's something that, and by the way, it's something that within the company, half of us are in Israel. And it's something we struggle with all the time, where how to make sure that our developers and our R&D team, they're amazing and they work super hard, but they're never going to be users of the platform. Right. So how do we convey to them what is the actual
the magnitude of the
Yeah,
problem,
exactly.
the specifics of the problem. Yeah, that's there was a gentleman that came on a while ago. He worked for a company called Health, and he grew up, I think, in New Zealand. I forgot exactly where he was born, but he grew up in New Zealand, went to England, then came to the States, and he had one of those like, what? Kind of moments with
Yeah.
the U.S. healthcare system. A couple other folks I know that were born in the States had a very similar moment in time. It does create that almost like you're dumbfounded the way that things work. It's why I've committed my life, honestly, to having these conversations.
And you're an expert. Don't you still have it sometimes where you get a
Oh,
bill?
I'll tell people immediately, I'm not an expert in navigating my own benefits within our own healthcare system. I talk about a lot of the stuff, of the solutions that stack on top of it. But when it comes to me and my family, I'm still at the mercy of not knowing or naivety that most people have as well.
Yeah,
and if I'm that way, then imagine somebody that doesn't have anything to do with this system is working.
I was at a conference last week in Miami, and I went with HR leaders, and we did a survey. How many of them feel comfortable with their healthcare? Very, very few. And then I told them, well, think about, that's you, but think about your employees. They're not experts in healthcare. They have no clue. So think about, if you're not feeling comfortable with your health benefits, how are they feeling?
Exactly.
And that's exactly what we're trying to solve, because the fact that you provide healthcare to your employees, because I talked a lot with CFOs, they say, oh, we give the best plan or the best benefit. The fact that you provide healthcare to your employees doesn't mean that you provide access to healthcare, right?
Yep.
And that's where we kind of come in.
Well, so tell me about the early stages. When you pitched these investors, you said you kind of had a pitch deck at that time. It was really conceptual in nature, I presume, at that time. Talk to me about the early stages of Healthee. What was it like in the early days? What were you actually doing, sort of core mission at that time?
So back then, this was honestly exactly 2 years ago. We just celebrated our 2 years anniversary on May 1st.
Congrats.
Thank you. It was myself and my co-founders. There were four of us. And it was mainly just kind of like laying out the vision of what we're trying to solve. Like, because there's so many problems. And as a startup, you got to be very focused, right? You can't just go and say, we're going to solve everything. So our first thing that we wanted to solve was we wanted to have a tool that just tells people what they're covered for in layman terms, where you can kind of come in and say, I have this, what are my options? I have back pains, what am I covered for? My daughter needs a speech therapist, am I covered for it? That's always like the main thing. And we realized that AI was advanced enough to kind of provide that. And we had to think about, okay, well, where are the answers? Because it's not enough to have an AI. And the approach that we took is we said, okay, all the answers, there is a document that all the answers are there. It's called your evidence of coverage, right? It's your health plan. Sometimes it's 600 page long. Sometimes the answer will be across multiple pages. It could be in page 30, 70, and 150. And it's complicated. So we said, okay, we need to build something that knows how to take all that data from those documents and convert it to something that's accessible.
Right.
But then the deeper we looked into it, we said, okay, it's not only those documents. There's other data sources that we need to access to get that data as well.
Okay.
And
what are some examples of those other data sources then?
So there's the carrier website. There's the providers themselves. There's many things that you need. There's pricing data that you need to access, claims data. There's a lot of data sources that you need to bring in together to really be able to answer those questions. And that's what we started building. Healthee's, for the first year, we were really focused on just building a product that is, again, has just one use case, which is answering a question about your healthcare benefits.
That one use case is powerful in and of itself, right? I mean, I can think about like what you were just describing, but let's say I do my knee hurts, right? Let's just take something very simple. My knee hurts. I don't know where to go if I don't interact with the healthcare system much. Like, do I go to my primary care physician first? Do I go to a knee doctor? Do I need surgery? Do I need to just take some Advil and rest? Like, all those questions I'm sure are going through most people's minds. And so to be able to just put into a search tool and then have intelligent responses, not Google my knee hurts and get a million responses with no really articulation. Zoe, if you will, is kind of layering on kind of some thought, right, to that question. So how does that work?
Thought and personalization.
And personalization.
Because you probably have a different health plan than I am. And my coverage is different than yours. And it's not only, can I do this? It's also how much it's going to cost me. When can I go get it done? Where can I go get it done, right? Because you're in a different network than I am. So when I ask Zoe a question, she will give me a different answer than she'll give you, because different demographics, different plans, different locations. And that's the beauty of Zoe, that she's personalized. It's not a Google where, hey, tell me everybody that has a knee pain, what do they usually do? I have a knee pain. What are my options? What are going to be the costs? Where can I go? What am I covered for? Are there any benefits that my employer provides me that I should check out first? Maybe I should talk to a doctor on the phone first because that's the lowest cost option. So it's really around putting the user in the center. And I think that's something that no other platform has done yet, where we put the user in the center. We try to help them get the best answer they can, but also get the best treatment at the lowest cost.
So tell me a little bit about what you can say, kind of the back room of this, right? Because artificial intelligence sometimes gets thrown around, and it's a little bit of a vague word. People hear ChatGPT today, and they think artificial intelligence. But what does it look like behind the scenes, and what you can share of how you're sourcing that information and then personalizing it for an individual?
So the first thing we do is we take your health plans. So we'll take your medical, dental, vision, and we'll do that conversion from an unstructured data source, which is just a nicer way to say a PDF, to a structured and mapped database where everything is mapped. So, for example, if you have diabetes, if somebody has diabetes on their health plan, they'll have 5 different places in the health plan where it says what they're covered for diabetes. It could be insulin pumps, it could be medication, it could be specialists, right? And it's all across the plan. We know how to take all of that and put it in one place where diabetes, this is what you specifically are covered for.
I see.
So that's the first part. The second part is connecting to all these data sources, claims data, providers, provider availability, provider location, in and out of network. So all of this, and then bringing to you and saying, well, this is where you're covered for. These are your deductibles, for example. This is where you are. You already met your deductibles. This is where you can go. This is how much it's going to cost you specifically.
Okay.
And this is where you can go.
So it does actually calculate the out-of-pocket for the member as well.
Yeah,
Great.
exactly.
Okay.
It will tell you, if you go do this MRI in this specific location, your out-of-pocket will be $21. If you go to the other location that is a mile away, it will be $50. And there's another one for $100. So it really makes you a much smarter consumer. Because today we're not smart consumers.
No.
Right?
Well, I would say not only we're not smart, but we're kept intentionally in the dark, I think, by design of the system itself.
100%.
Which is where I like technology like this, right? I don't really, on when people that come and talk on my show, I don't really make judgments about, oh, that one's better than this one, or this one is I would refer this one to that one. But I do like when people have a mission to sort of unpack and unravel the healthcare system and make it better and more useful for the individual, right? When I think that's a mission I can get aligned with anybody that sits on the couch. But so let's talk more about the mechanics of that. Let's say my employer offers this. How does an employer go about delivering this initially to its membership?
So first of all, we're a B2B, so meaning your employer has to buy our platform to be able to provide, so for you to use it. Okay, so let's start there. And then once if you're an employer and you want to start using our platform, there's a very, very minimal lift from you as an employer. All we need are your health plans, which is those PDFs, and your census. Okay. And if you have any additional benefits that you provide to your employees that are related to health and wellness, we'll take your employee brochure or whatever you have. We don't need you to do anything, then send us PDFs. Okay. And once we get that from you, we'll convert all that data to the structured data source. We'll map it, we'll ingest it, we'll put it in the platform. We'll build a platform that is tailored to you as an employer. Okay. Based on what you're offering your employees. And that's it. And then we'll do basically we'll sit down with you and say, okay, what is the best engagement strategy? How do we best engage with your employees? Yeah. Are your employees more tech savvy where it's better to send them notification? Is it better to text them? Is it better to send them postcards to their house because their spouse is the one dealing with their healthcare? So we are very, very focused on engagement. We have an amazing customer experience team that's what they do. Our number one KPI, our number one metric in the company is user engagement, is monthly active users. Monthly active users, okay. Because we know that if we get users or employees to use the platform, that's the only way we can influence their health. It's the only way we can reduce their health cost. Yeah. So we're constantly working on ways, if it's by reminding employees about preventive care, right? So we have this new feature that we just released or are releasing now that's called Wellness Tracker. Okay. It basically builds your wellness plan for the year. Your wellness visit in the doctor, your skin screening, your dental cleaning, everything that has to do with preventive care. And it's it actually maps out the year and helps you sort of plan when to go to these different. Okay. Where to go, when to go, where to go, how much it's going to cost. Usually those are there's no charge because they're preventive care, but we'll build that plan for you. That's cool. So you can track it throughout the year and see where you are in your wellness tracker. Is there like a calendar embedded then, or does it sync with your Google Calendar? We'll sync with your calendar so you can book appointment based on when you're available and when the provider is available. And then that's kind of like how we want it. Does Healthee actually assist with the appointment setting itself? Okay, so how do you connect the consumer and the provider in that situation? So there's different ways. We're connected to companies that do appointment booking, like ZocDoc. Okay. So if a provider is on ZocDoc, you can book an appointment straight from there. But we also have a way for if let's say you have your provider for some reason is not tech savvy and they just work on the phone, right? You can literally put in when you're available, and we'll make the appointment for you. We'll call your benefit experts. We have a team of amazing benefit experts, so shout out to them. They will do that for you. They'll book the appointment for you. So you can say, okay, I want to get my skin screening in July, right before the summer, in this location at this time. And we'll go and book it for you.
That's awesome. Well, so, I want to go back to what I was saying when Nina and I saw the platform maybe about a year, maybe even a year and a half ago. I saw it in its pretty early stages. But it's obviously evolved. So what are some of the things that are now plugged in? Because you talked about creating this healthcare ecosystem that a member can interact with, find what they need, shop, all these things. So what are some of the things that have been added to the framework to create that ecosystem?
So when we started, again, it was just mostly questions and answer. I have a coverage question, I want to give you an answer. But that's a very, very kind of narrow part of what we're providing now. Like what you saw is probably 5 to 10% in our capabilities today, because we realized that we want to become a one-stop shop. Now, why do we want to become a one-stop shop? Because we did a lot of user research. And one of the main pain points that we got is that employees today, they have 3 phone numbers for their healthcare, right? Medical, dental, vision, to go ask questions. They have different platforms for choosing a plan, for booking appointments, finding providers, and they just get lost. And there's so many options that they just don't do any of them. So we said we want to become this one place, this one-stop shop where employees meet us at open enrollment. We help them pick a plan that is best for them and their family. And then we help them throughout the year with any questions they have. And we help them with booking appointments. And we help them with wellness trackers and doing preventive care. And we now are about to help them with billing as well to make sure that they get billed correctly. So our offering today starts the second the employee either joins the company or they're in open enrollment, because we have an open enrollment. It doesn't have to be a tool. It's more of a comparison tool. So you don't have to make the selection on that tool, but you will make the comparison.
So you actually are providing some guidance for the choosing. So how do you evaluate? Does it take into account like their family situation, maybe income level, the options are available?
So
what all is involved in that?
So we look at 2 main factors. One is financials and the other one is coverage. So first of all, we'll show you for each plan, what is your cost? What is your premium? You're basically from your paycheck, right? Every month or every 2 weeks. We'll show you deductibles and out of pocket for each plan. Then we'll show you which of the doctors that you usually go see, you and your family, your dentist, your specialist, your primary care physician, are covered under each one of those plans. Because, for example, I see a cardiologist once a year. I want to make sure that she's covered under the plan that I pick, right?
Right.
And then, which is a really cool part of the platform, we'll build these financial scenarios for you, where we say under each plan, if you're healthy next year, this is how much you will spend on healthcare next year. If, God forbid, you have a catastrophic event, this is the maximum you'll spend on healthcare under each one of those plans. And you can even build projections. You can say, well, I'm thinking about having another baby next year, or I'm thinking about having surgery. So Zoe will build those projections for you and tell you, well, under this plan, you can expect to pay this much. So at any given point, you become a much smarter consumer because you know the coverage and you know the financials. And at any given point, an employee can click on this button where a live expert will show up. Again, one of our team. And they can, if there's more questions that they have, we can answer them. So that open enrollment experience becomes much less overwhelming. 50% of employees will pick the wrong plan.
I don't doubt it. Especially because you don't really know how to make heads or tails of the deductible, the networks, you're out of pocket. How does that, how does those things interact with how much premium I'm going to pay and what's the best choice?
What is an HSA? What is a PPO? What is right? So all of that are answered within our platform. And the feedback we're getting is amazing, right?
Well, I don't doubt it. I mean, there's a couple insights that you told me over coffee that I thought were pretty interesting. One, it starts to sort of learn kind of the member over time, but that you're able to actually aggregate sort of some of the things that are most often searched for, or maybe common problems amongst an employee population, and share sort of de-identified data back with the employer. So tell me how that works and how those employers might use that data to make decisions in the future.
So today, usually employers over 100 or 200 employees, will get a report every end of the year with claims data, right? This is what your employees used, what type of benefits they used, or health benefits. And what's interesting is that we all make this, we as leaders will make decisions based on that. We say, oh, there's a lot of questions about mental health, maybe we need to bring something else, or there's a lot of questions on acupuncture. But you're missing a big part in that report, which is what are your employees asking that you're not covering?
Right.
Because there's never going to be a claim data or claim information about something that you're not covering, right? Because your employees either won't do it or they'll do it privately. And what we are able to do, we track every click of a mouse, every question that's being asked for Zoe, every hover of basically everything that's being used in the platform Obviously, it's all anonymous. It's all aggregated. But we can show you as an employer or as a leader, hey, here are the benefits your employees are really asking about. And it could be things that you're not covering.
Right.
Or it could be things that you are covering, but they just don't know about. So maybe we should do a campaign. Maybe Zoe should do a campaign around mental health because your employees are asking questions about it. We just had a customer where we showed them the top 5 benefits that employees were asking about. And the number 1 benefit was about something that they were not even covering. So think about that aha moment for that employer where they realized that for years they've been covering, they thought they had this amazing benefit package, but eventually the number 1 benefit.
Well, you're almost doing a survey, but you're unbiasing the survey because I'm not a member that, or an employee that's going, I got to answer the survey, or I'm not so sure if I want to tell my employer this.
Exactly.
But
not only
collecting that anonymously, like it's unbiased, right?
Exactly. But not only that, because I was at a conference and one of the HR leaders there mentioned that one of the things that she hates the most is that when they do a survey and an employee will say, why aren't you covering X? But they are covering X. They just don't, the other employee doesn't know it.
Yeah.
And she can't go back to that employee to say, hey, we are covering it because the survey is anonymous. So for us, when somebody asks for a benefit that is not covered, if now it is covered, we can go back to that employee and say, hey, you asked about this 6 months ago. Now you have you have a benefits for that, right? So it's a really different way to engage.
Well, that and the other part that what kind of goes back to the anonymity that I was alluding to earlier. There are certain things that you were telling me that people might not want to share with HR. They might be afraid it's a violation of their privacy, or they don't want to tell their HR person they might be planning on having a baby.
Right.
But you're able through this system to collect that again anonymously, and people are more open to share because they don't feel like somebody's going to judge them for sharing that information.
First of all, every HR I speak with, they don't even want to know, right? Because it's not HIPAA compliant. You shouldn't know if an employee is planning on having a baby or if an employee has depression or anxiety, right? You shouldn't know as HR. That's a violation of HIPAA. But employees, if they don't have anyone else to ask, they'll come to you as HR, right? Yeah. But sometimes they just don't feel comfortable. Like, who wants to go to HR and say I have anxiety?
Yeah.
And the fact that they have a Zoe, they have something that's private and personal, gives them a chance or some kind of a channel to go and ask those private questions where you don't want to ask someone else.
Well, and I want to ask you about artificial intelligence. Let's actually kind of define how it's being utilized here, and I want to ask you about how ChatGPT might be changing kind of the future of your company. But when people say artificial intelligence and they use artificial intelligence, can you tell me like what that actually means to you and means to Healthee?
Yeah. So for us, it means a way to know everything about your health benefits and your health coverage, right? So it's a way where we can take, because what is it? Why can't we just use human intelligence? Well, because these are hundreds of pages long, thousands of plans. If we just use a person, it will never end. Like, you can't have a person that knows all your benefits. It will take them hours. And most of our competitors, that's what they do. They'll use human intelligence. So you'll ask them a question, and then they'll get back to you in a day or two, which could be great for some people, but Gen Zers, millennials, they want an answer now. And that's exactly what AI can give us. AI can find exactly that information that you need instantly. And that's what we do. You ask Zoe a question, she's not going to say, I'll get back to you in the next few hours. She's going to give you the answer right away. And sometimes that's what you need. And that's where the AI component
Well, and
comes
then
in.
if you need the human intelligence to be layered on top of it, you effectively supercharge that. I've heard people talk about how like direct primary care providers, doctors, can use ChatGPT to sort of search for symptoms. And I actually saw recently somebody made a post on Twitter where they actually reviewed doctors analyzing like 100 conditions and then ChatGPT analyzing the same conditions. And actually ChatGPT did slightly better at diagnosing. So it's not to say, hey, this replaces the human. What if we put that in the hands of the human and made it a lot easier? It enhances
the human, exactly. And we are actually now, and we are fortunate that we have an amazing R&D team and an amazing VP R&D, and they looked at what can ChatGPT, how can it help Zoe, and how can it enhance Zoe? And it's amazing to see in a very short time we're already able to do it, and we're able to make Zoe even better using ChatGPT. Obviously, it's not out yet, and it's something that we're still developing, but already initial reaction and initial results are amazing. Yeah, it just makes her much better.
Well, and it takes, like, when you think about a doctor evaluating somebody that's sitting across from them, there's time constraints, right? They may be a fee-for-service model where they have to get people in and out in 10 or 15 minutes or less. They might have had a bad day. They might be hungry. They might not have been paying attention to everything that individual said. So the human being that's taking in the information from a patient and then trying to interpret, analyze, and make a recommendation, there's a lot more biases. And I don't mean biases like some sort of judgment about a person. It's biases of all these other inputs that are affecting their ability to actually objectively make a decision. ChatGPT or any AI is actually removing those biases out.
That's one. And also it just frees up more time, because I was talking to a dermatologist the other day and she said that she has to see like 50 patients a day. That's her minimum. She has to see 50 patients a day. And I said, how much time do you spend with each one? She's like, 5-10 minutes maybe. Right. And that's crazy.
Well, that's another problem with our model that I've spent episodes talking about. But I want to kind of zoom out, if you will, because I know I've come from the world of software. Obviously, I've changed jobs. I shared with you. I've shared on the podcast publicly now. But I understand the world of SaaS, of technology and SureTech, and how fast and how rapidly it evolves. So give me a little bit of the insight of what the future state might look like, or some of the things that you're looking at solving for.
So I think, first of all, our platform evolves constantly.
Yeah.
So we have a development team in Israel, and they work in 3-week sprints. That means that every 3 weeks, something comes out. And it's amazing, because we've even internally, we meet every 2 weeks where they show us all the things that they're working on. And every 2 weeks, it's something new, it's something better. And it's amazing to see how things evolve. Again, I mentioned it, like you saw the platform a year ago, it's completely different. You saw 5% of it today. And when I think about, like, it's hard for me to even think too far ahead, because so many things are going to happen in next year. So many things are going to happen in the next 6 months. So I mentioned ChatGPT. I mentioned we're working on adding the billing part. We're working on adding pharmaceuticals and prescription medication. We're making the platform much more. We're user obsessed. So we're really trying to make it as accessible as we can. We always like to say that we're the opposite of healthcare, because we're accessible. And we have a team that does many user research and user interviews just to find ways to make the platform even better. So if you see how the platform evolves, it's like a sprint. It's every month it looks different, and there's another feature that comes out. Now, if I look at long term, I want to become, again, the one-stop shop for everything that has to do with your health and wellness. So you don't need any other system. You don't need another system you already don't need it when you use this for open enrollment. You don't need it for ongoing support. You don't need it for pricing. You soon won't need it for prescription medication. You'll soon won't need it for billing. Eventually, you won't need it for claims. And Zoe, as she evolves, her ability to really become that personal health assistant is just going to enhance, right? At a point where she'll be able to predict what you need before you need it. At a point where you'll be able to seamlessly access Zoe at any medium that you want, just as like you do with any other person that you speak with. Yeah. And that's where you want to go.
Well, you mentioned it being an infinite market potentially as well. Right. I mean, I can even see where there's opportunities in like health coaching, nutrition, fitness, right? The intervention, right? I mean, I see a wearable on your arm. I assume obviously the data that's collected in that wearable could be ingested and utilized, right? And tracking maybe a catastrophic event or detecting perhaps a uptick in your heart rate or blood pressure prior to a big event. The sky is literally the limit.
It is. And when I look at what we accomplish, and it's mostly our development team, whatever they accomplished in the last 2 years and where we are now, it's just mind-blowing. And I can't wait for the next 2 years and 4 years and 10 years, because it's just amazing how much improvement and advancement we're doing with this technology.
Well, I want to zoom out to the big picture, the healthcare system in just a moment, but I will be remiss. I want to give you an opportunity to talk brass tacks, right? So I know a lot of my audience is consultants or operate in the employee benefits ecosystem, with a lot of them being on the broker side and working with employers. So let's talk about deployment of this. Like, what would it be like to, hey, I've got a group, I want to put this in motion. What does my employer need to know? What does the timeline look like? Talk to me about the brass tack stuff.
So first of all, I think we work a lot with brokers, and we onboard new brokers almost every day, basically, because I think brokers, they're really smart and they always know that they need to be at the cutting edge of technology. And that's where we are. And it's never a good situation where we talk to an employer and they bring in their broker, and then the broker doesn't even know about us or wasn't the one that brought us in. Okay. So we always like to come in through with the broker, because it's a really good opportunity for that broker to kind of show that, hey, I'm bringing you, the employer, the best solutions out there, or the cutting edge solution out there. Our timeline is pretty straightforward. It's 4 to 6 weeks until we can fully deploy.
Okay.
Very minimal lift on both HR and the broker. All we need is those health plans, and we do all the work. And that's it. We do all the engagement. We do campaigns. We are constantly focused on engagement. So the HR, all they need to do, and the broker, is just collect the data that we provide on
And you
usage.
sort of take care of the rest. Yeah.
Exactly.
What about deployment in terms of timeline? Does it have to be on renewal?
No.
It does not have to be on renewal.
Doesn't have to be on renewal. We actually like to go off cycle for a few reasons. One of them, if you do it early enough, you'll have enough data, but by the time it comes time to open enrollment, that you can use that data to kind of decide which plans you want to use, want to present. It also better because you kind of create that engagement, trend, right? Where people start to get to know Zoe, and then when it comes to open enrollment, we get to 80-90% of enrollment, which is much easier than if you just start at open enrollment.
Yeah, because it might get sort of lost in all the complexity of that enrollment process. And then no limitations on kind of fully insured or self-funded, group size limitations. You said it does have to go through the employer, though. So an individual that was listening to this couldn't go purchase access themselves.
The only thing an individual can do is they can go on our website and then put their email of their HR, basically. Or
there you go. Hey, if you know your HR person or broker that needs to contact to guide, definitely go in and put your email in. But that deployment, it sounds like you guys take care of most of it. You said it doesn't have to be on cycle. It's employer-based solution. It's a PEPM model, correct, in terms of pricing. And then really once you sort of pay the fee, everything that's within that ecosystem is accessible. And Teledoc is, or not Teledoc, but Telehealth
we
is
have
part
telehealth
of it as well.
Yeah, we have Telehealth as an add-on that you can use, and that's part of the platform. And then, that it's very, very straightforward and easy to use and easy to implement. And we're getting really good feedback, really good results. So we're seeing reduction in claims costs of anywhere between 4 to 14%.
Okay.
We're saving employees between $1,000 to $2,000 a year on their out-of-pocket. And for some employees, that could be another paycheck that they get, right? So it's significant. And we're saving HR 9 hours a week from dealing with
that's when you can quantify, and it sounds like you've already done, but like when you can quantify the ROI in terms of dollars and time savings, because this is on the surface initially you might say, well, this is a nice to have and this is a quality of life improvement, but is it a necessity? Well, if you look back in the terms of financial ROI and time ROI, then you go, it's almost not only is it a necessity, but if you don't have it, you're missing out. You're probably losing employees as well because it's difficult to retain them or attract the best ones. I have come from the insurtech world where I understand some of these consultants get point solution fatigue, so much being thrown at them, and they don't know how to vet the good from the bad. But when you can start proving actually that there's tangible return on that investment and they can quantify that, that's when it becomes very, very sticky.
Yeah. And I'll say two things about that. First of all, I meet a lot with CFOs and HR leaders, and I always talk about the cost of doing nothing. Yes, you're right. This is not, you don't have to use our platform, but the cost of doing nothing means that you're going to keep seeing increasing costs, right? Your healthcare is going to keep increasing, sometimes double digits every year. You're going to see wasted benefits, and you're going to see just poor employee experience. When you think about healthcare, we spend, 1,000 employees could be almost a $9 million expense for a company. $9 million. That's a lot of money that you spend on anything, right? It's probably your second biggest expense in the company. But your employees are getting a poor experience out of it. Yeah. So it's counterintuitive. You're spending so much money on something, but getting a bad experience from it.
Yeah.
So that's not great. And 70% of employees will move a job because of health benefits. So that's one thing that we need to remember, the cost of doing nothing, right?
Absolutely, yeah.
So, and that's one. And the other thing to also remember is that the ROI, our cost is when you think about $9 million for 1,000 employees is meaningless compared to that. We're seeing ROI that is anywhere from 50 to 100x sometimes.
No kidding. 50 to 100x.
Yeah, right. Because how do we save money, right? We save money basically by steering employees to high quality, low cost options. If you have a knee pain or back pain, you need to get an MRI right here in this area. There's probably about 300 locations where you can go and get an MRI within a 50-mile radius from here. The average cost is probably $1,500 for an MRI. Not for you, but for the employer or for the insurance company, the claim. For you, let's say $150. But it also means that there are locations that are going to cost you $20, and there are locations that are going to cost you $500.
Right.
If I can help you, and that's what we do, if I can help you go to that lower cost by still high quality options, I'm saving you money right there.
Well, not to mention if the employer layers on incentives to direct those people through, maybe waiving their out-of-pocket costs, right? Then you get a doubling down of that effect. Yeah. I can imagine one claim intervention or redirection with that situation might pay for itself and then some, just with one.
Exactly.
Right, and so then it becomes like an absolute no-brainer. I mean, I look at what you're doing, and there's other folks in this space that have a similar mission, might go at it a little bit differently, that those are going to be a standard. Like what you're doing is going to be a standard way that people interface in the future with healthcare. I think it's only a matter of time.
And we don't see ourselves as a point solution. We see ourselves as a platform where all point solutions can live. Because if you have point solutions, they can be they are part of Healthee. Because let's say you have a solution for mental health or for fertility. An employee can go to Zoe and say, hey, what am I covered for fertility? And we'll bring in that solution and say, this is what your employee is already covering. So we actually also increase engagement with the things that you already are bringing to your employees.
Yeah.
So we don't see ourselves as a point solution. We really see ourselves as like a platform that is a one-stop shop.
Well, so let's go big picture and let's kind of land the plane here. No pun intended with your Air Force experience. I use that term a lot. But what about kind of the future? What do you see in the future of healthcare? You've been in the States for how long? About 11 years now. Yeah. Okay. So obviously you've seen a little bit of the political stuff. You've seen obviously the comparisons of private and public sector. Yeah. You come from a world where there's more socialized healthcare. Not asking you to weigh too much in a way that puts you on the spot, but what do you see happening in the States in terms of healthcare?
I see, first of all, I think like user expectations are changing, right? Especially with the shift towards, the workforce becoming more millennials, Gen Zers, right? It's going to be 60% of the workforce. And these are people that are not going to be okay with calling a call center. They're not going to be okay with not having the data readily available for them. They're not going to be okay with getting a surprise bill. And I think those are things that we'll see at some point. They'll have to kind of like be gone from this world, right? It's just... Companies are not going to be able to survive if that's going to be the user experience that they provide. Because think about these employees, they grew up with shopping on their phone or computer, calling an Uber on their phone, like not talking to a single person for everything that they need. Right. And then they go into this, when they're 26, they start using their healthcare because they're not on their parents' healthcare anymore. And they're getting a whole different user experience. That's not going to fly. So I think that's one thing that we're working towards.
Just by very much the groundswell of demand for change, it's going to happen organically. I would agree with you there.
Yeah. So I think that's one thing that's going to change. The other thing is that, we're seeing this with the Transparency Act and kind of like all this thing about pricing. It's not still as readily available as it should be, but I think it will be like in the next few years, and we'll have to make that accessible to users and employees and people in general, right? They'll need to know what things are going to cost. They'll need to become smarter consumers. Absolutely. The era of just being, think about like Amazon with no prices. That's what we're doing with healthcare. Right. You order something that looks cool, and then you get a bill 60 days later, and you're like, what? Exactly. How much was that? Yeah. That can't stay like that. That's something that will have to change. Well, it's true consumerism, right? Yeah. The whole idea of the high deductible health plans was consumer-directed healthcare, right? And make people better consumers by giving them more skin in the game. I think it actually had the opposite effect, unfortunately. This sounds like true consumerism in that there's actual transparency in the way that you shop and consume healthcare before you even go, right? You know what you're getting into, and that's the real difference in my opinion. And I think there's these, especially the large carriers, the companies that are over 100 years old, it's going to be hard for them to be true innovators, and that's where we're going to come in. And companies like ours, there's many companies that are bringing innovation into this whole world of healthcare, and that's where we're going to see that innovation coming from. Well, I love it, man. Why don't you do this real quick, Guy? Closing thoughts. We've been talking probably close to an hour or so, but just curious, what if people that have listened this long, and this has been great, I genuinely enjoyed this, what would you leave the audience with, something food for thought? I think just think about, I would ask to think about the last time you had an interaction with your healthcare. And if you close your eyes and you think about it, was it a good experience or was it a bad experience? And I think most people will probably say it wasn't a good experience and it could be a better experience. And that's exactly what we're doing. And if you're trying to either give your employees a better experience, or if you're a broker and you're trying to bring technology that will empower your customers to have a good experience with healthcare, that's what we're doing. And if you want to find us, we're at healthee.co. Healthee spells with 2 E's at the end. I'm Guy at healthee.co. So feel free to reach out. We're always looking for partners to help us with our mission to make employees healthier. Well, I love it, man, and I'm with you on that mission. So I wish you nothing but success. I'm glad we got a chance to do this. Give Nina all the best if you see her here soon, especially Omar as well for scheduling this. But I really appreciate your time, Guy. We'll let you get on your way, and I can't wait to share this episode. Thanks for having me. My pleasure, man.